Everyone, this is Dr. Jonathan Streit with the Institute for Restorative Health. And today we're going to talk about interference fields. And these are the stealth factors that prevent chronic illness recovery. But first, we need to make sure everyone understands that the content of this video is for educational purposes only. It is not intended as a substitute for professional advice or a diagnosis or any treatment. With that being said, let's get started. So what is an interference field? First off, what I have noticed in working with chronically ill people for over the last 15 years, when I go home at night, I often think, why did that one person not get better? Why did that person not react normal the way I would normally see a patient react with a therapy or an intervention of some kind? And what I did is I studied this, I researched, and I tried to figure out where in the body is there something that's blocking their healing that creates this treatment resistance in people. And what I found was the study or the research written by two doctors that they called it interference fields. And I looked into it further, and it makes so much sense that this could be an underlying factor of why some get well and some don't. So what is an interference field? It's damaged cellular tissue. It's damaged cells that don't allow the proper function of the body. Now, how are they damaged? It could be poor nutrition. It could be environmental factors. It could even be injury to the area. This is areas of abnormally low cellular voltage. So if you remember in one of our last talks about cellular voltage, how important that is for the detox of the cell, it also plays in the world of interference fields. This is actually, an interference field is really an impedance of electrical flow that prevents healing from happening. And this could very well be the reason why some get better and some don't. So how do we detect interference fields? We use biosystems integration, which is a technique that we utilize through our biorestorative method lens to determine what's going on at the cellular level. And we can look through, symptoms. We can look at a person's the signs, symptoms, the epigenetic factors, their environmental factors. We can look through this exhaustive case history review. We can do all of these types of things that are deep dive into the person, and we can really start to pick apart where these interference fields are, and we can actually find them and trace their dysfunction because we know the body that well. So what is the importance of clearing these interference fields? It restores proper electrical flow. So if you remember the other on a previous talk that I've done on cellular voltage, every cell needs negative 25 millivolts of electricity. Well, the lower that gets, if we get negative 15 or negative 10 millivolts, what ends up happening is the electrical flow changes. Our body gets more acidic, and we don't want that. We want a more alkaline body. So removing interference fields improves the alkalinity of our body by balancing our cellular nutrients. So we have all of these nutrients in and around our cell, and we need them to get in and we need them to get out. And we need detox. We need toxins out of the cell as well. And that's all being done by that cellular voltage. Interference fields are areas of abnormally slow or abnormally low cellular voltage, and it could be brought up by injury and other dysfunctions. So we need to clear the dysfunctions in and around the cell and in and around the tissue. For instance, if we had a root canal, or if we had a wisdom tooth removal, that's a very common area for an interference field to start. And every tooth has a organ, tissue, and gland that's kind of associated with it. So if we have a problem, an interference field up here in the jaw, then we know, was it, the first tooth, was it the wisdom tooth? So we can kind of trace along. That may be something to do with the heart. It might be something to do with the lateral elbow. Wherever the body takes us, we can actually help unwind those interference fields and really start to bring health back to the body, because now the body can remove waste and the body can maintain its cellular voltage. So what are our methods to clear these interference fields? Now, traditional medicine, there's a physician by the name of Dietrich Klinghardt. He uses injections. It's called neural therapy. He uses a chemical compound that he injects all over the body in different areas. And what that does is that hyperexcites the tissue and that changes that interference field. Now, we can do non-invasive techniques here at the Institute for Restorative Health, and we get great results. We can use low-level laser. We can use percussive waves or pulsed electromagnetic field therapy. We can even use terahertz frequencies to disrupt these interference fields and bring health back to the body. So treating interference fields can absolutely initiate healing in resistant areas. So if you have someone in your life, or if you yourself is treatment resistant and hasn't been able to heal for a period of time, it very well may be interference fields causing this. And this is what we do at the Institute for Restorative Health. We look through each of our patients through the lens of the biorestorative method, and we detect and trace out these interference fields, and we remove them using non-invasive techniques. I really appreciate you watching this video today. If you could take the time and subscribe and follow our channel or any of our other social media channels, we'd really appreciate it. I absolutely love bringing new information to each of you every day. I look forward to seeing you in the next video.